This is Focus TV, straight to the point.
Yes, we back, and when we back here, I remind you about basically you can remember that biblical story about the giant called Goliath, and then you are the David there. You are that small person, and you're looking at cancer as the biggest giant you've ever had of, and you like, where do I get that sling? How can I, I don't know where to aim it. So that's why we are coming to the question of can we cure cancer?
Like you to, in fact, I'm happy you brought up my name, David. Actually, yeah. I'm David, and this cancer is Goliath.
Okay,
so
okay.
There's a David in the studio.
Yeah. Good. And we have Goliath, the cancer. Yeah.
So I think before we talk about that, I think it's good to mention about some of the signs and symptoms, because our viewers might be wondering, okay, now how do I know that I have cancer? How do I, what is it that I will see that will make me think that I should have a medical consultation that will maybe allow me to know if I have cancer? And we have several signs and symptoms. Again, these are specific to different cells, specific to different sites. And I think being a breast cancer month, I think it would be fair only to just focus a bit on breast cancer and say that some of the signs and symptoms of breast cancer include when you have changes on the skin or on the breast, when you have for example, you look at your breast and you see a vein, you're seeing a new vein has developed on top of the skin. You can see some skin changes where you can see a wound, or you can see like when you an orange, you call it orange peel appearance. Okay, so when you do an orange, you can see some pores on the orange. That same appearance might appear on the breast. You might feel a lump. You might see a discharge, and this discharge can either be milky, can be blood on the breast.
All right.
You can feel nodes. You can feel some enlargements in your armpit, and you feel some of the things that you're feeling that something is not going on well there. And you can also have pain.
All right. All right.
So, for breast cancer, those are some of the main things that we think about. And maybe also just to mention a few others. For example, prostate. It's good to mention because men have been shown that by the time they come to hospital, it's a bit too late.
All right.
And remember, this prostate affects one of the most private and most sensitive of systems for the men. And one of the signs and symptoms is that when you are going to pass urine, it is a big challenge for you.
Okay.
So you're having trouble passing urine, and if you do, you're not passing all of it. You still feel like your bladder is still full.
Okay.
Right?
Yeah.
And you have a lot of frequency. You're going to the bathroom a lot of times. And sometimes you might have some dribbling on your trouser. And these are some of the signs and symptoms to do with prostate cancer. And it's good to think about them because when you have these kinds of symptoms, it's good to now go and seek some help.
All right.
At this point also, let me mention that majority of the cancers, around 70%, appear in people who are between 55 years old all the way till maybe 70 or 80. So it's good that during this period, people start thinking about what's going on with their lives.
All right.
Okay.
Yeah.
So as we now answer your question, can we cure cancer? I think Dr. Tani has a good response.
Yeah.
Yes.
David himself.
Yes.
David.
So let me slay
the giant. Yes. All right.
I think I want to, just for viewers' benefit, for them to appreciate this problem called cancer. I know this is coming a bit late, but I want to throw a statistic to you that in the year 2008, the WHO found that worldwide we had about 13.1 million new cases of cancer, and out of these 13 million, 7 million of them died. To put it in a number that the viewer can understand, this was an average of 21,000 people dying per day.
21,000.
21,000 people dying per day.
Okay.
This is worse than a tsunami. It is worse than a bomb. It deserves the attention of people.
All right.
It is time people actually realized that cancer is very bad. It is worse than a road traffic accident. It seems that most people seem to be shocked about death due to the nature of death when it is a bit violent. But this cancer is a slow-growing process that is painful, causes a lot of suffering, and eventually may leave people dead. But to answer the question, is there a cure to cancer?
Yes.
And we can vehemently say, yes, there is cure to cancer.
All right.
You can cure certain particular kinds of cancer. And for example, a common success story is a cancer we call Hodgkin's lymphoma. Extensively studied, a cancer of the lymph nodes, and this one can be cured. You will be restored back to normalcy.
Maybe define a little bit wider. Lymphoma cancer.
Yes, Hodgkin's lymphoma.
Okay, what does it affect?
It affects the lymph nodes.
Okay.
Yes, the lymph nodes are these things that drain blood from our tissues.
Okay.
They're usually in our armpits, in our neck region, in our inguinal region.
Okay.
They usually drain the lymph fluid from our body.
All right.
Lymph is just a product of blood when it
Okay.
is filtered at those capillaries.
Yeah.
Yes.
All right.
So
Kikuyu may call it Ngai.
it's called Ngai.
Ngai.
Yeah, I only ask my patients sometimes Ngai because I come to this side.
Yeah.
Because the elderly ones just know yes, Ngai.
Yeah.
Ngai
All right.
is
Yeah.
one.
All right.
So this is a
That's
cancer.
next one.
Yeah.
Yeah.
So this is a cancer that has been extensively studied. Its pattern is very predictable. You can easily eliminate it.
Okay.
Other cancers, we can deal with them in terms of cure. Is you can cure some cancers by simply excising.
Okay.
But this comes at a particular point in time. You have to excise it at the right time.
Okay.
And this is where the element of these campaigns we're doing, awareness, prevention, because when you detect this swelling very early, sometimes even breast,
Yeah.
before it comes out of control, you can remove it, and this patient might even achieve cure. You can be able to sort them. So we are not completely hopeless. Yes. So in terms of preventing cancer, we have very many avenues of dealing with this. These are the usually you see breast cancer awareness month, cervical cancer, things like as simple as doing a pap smear.
All right.
A pap smear is where a lady goes and the cervix, we collect a sample from their cervix, we look at it under a microscope and we tell them some cells here look funny, they might develop into cancer. This is something that if you do annually, you can save yourself the burden of cancer.
All right.
Yes.
Okay.
You can
Just to add on this, actually the statistics now show you can do it every 3 years.
Okay.
So I know it's an uncomfortable process for some ladies because they may not have had a very good process going through the pap smear. But now they need to have confidence in that there are newer, there are more friendly ways of doing a pap smear.
All right.
And once you do it now, you can wait until 3 years before you do another one.
Okay.
So it is a screening modality, like he says, that is very good in terms of capturing very early changes in the cervix. That consequently we can even achieve 100% cure rate by maybe surgical excision on the cervix.
All right.
Yes.
So basically what I'm understanding from the doctors themselves, they're telling us, first you got to get the core roots of the cancerous. Now from there we can define whether it is a non-modified or modified, and then from there we go to the other stage. So basically, even as we wind up this wonderful discussion, maybe I bring it to Dr. David, and the simple question is, how prepared are we as a country, as a nation, in terms of logistics and being ready for this dangerous disease? How where are we? Where are we?
To answer that question, I would say we have a lot of room for improvement.
All right.
That's what I will tell you. There is a lot of enormous room for improvement. That means what I'm basically saying in the negative is we have not yet done enough.
All right.
There's much more to be done. But the one thing that comes to mind recently that I remember, for example, the government has done is it flagged off something we call the Nairobi Cancer Registry.
Okay.
It gave about 17 million sometime in earlier on in the year. This is a combined effort in Nairobi, Kisumu, and Eldoret, where they are trying to quantify this problem of cancer. We want to know how many women are getting this cancer, how many children, from which part of the country are they? Are they getting intervention? Are we getting them when it is very late? Yes. And the other things that we need, we do not have capacity to sometimes diagnose some of these cancers.
Yeah.
And this is on the front of, number one, we have a shortage of clinicians who
Okay.
are highly trained
Okay.
for this technical job. Like, for example, the number of pathologists in this country, the people who make cancer diagnosis in the laboratory, we have about less than 150 in this country,
Okay.
of 40 million plus. So we need more pathologists. We need more clinicians who are trained in dealing with patients whose specific problem is cancer. We want surgeons who are able to, a surgeon who operates mainly on maybe cancer of the breast.
All right.
Because we know the outcome is going to be greater and better for the patient. We need multidisciplinary approaches where we have from your clinician, clinical officer to the sub-district, to the medical officer in a district hospital. We need all these people to create this multidisciplinary approach to a particular patient. We usually have in this country a situation where once you leave it to the other person, let them sort it out.
Okay.
But we will not slay this Goliath of cancer by that approach. We need a multidisciplinary approach and constant communication between doctor, surgeon, pathologist, people who do x-rays, and radiologists who are investigating these patients. Yes.
Thank you.
I think just to add on this, cancer registries have been in Kenya
Yeah.
since 1998.
All right.
The first cancer registry was in Eldoret in Uasin Gishu County. It was based at the Moi Teaching and Referral. So in 1998, they had already started quantifying based on the population they were seeing in Eldoret. And then in 2001 is where we got the Nairobi Cancer Registry. Now the unfortunate thing about this is that it only quantifies for the residents of Nairobi. So remember, the cancer registry, it helps in people knowing in the country now, starting to find out what are the risk factors that these people are being exposed to, and consequently what can we change in policy to reduce the cancers. So you have Nairobi Cancer Registry that started in 2001. But in terms of what the government is doing now, I would applaud some of the things that have been done, because in 2013 there's a task force that is trying to come up with a national cancer registry, so that we can be able to now assess the population in different areas and be able to find out what are the risk factors these people are being exposed, for example, in a certain area. Why are people from maybe Ukambani coming with a lot of liver cancer? Where are people from Coast coming with a lot of skin cancer? So there are several things that they need to assess, and this is the effort that now the government has put in terms of coming up with an international task force that has included such partners as WHO. If you have the Ministry of Health, we have hospitals, large hospitals, like Aga Khan, we have the MP Shah, we have all these players that have come into this to try and now fight and slay the Goliath of cancer.
Wow. Now that's bring us almost to the end, but before I call it a day, maybe I can give you a parting shot, Mr. David, alafu Mr. Dr.Robert, alafu we can close it.
All right.
Yeah.
So my closing remarks is I would want to give out hope to everybody out there who is dealing with cancer. We are all in this together. You need to know that the biggest problems in this world can be solved when they are small. We have the opportunity to change the path of this country. Let us make efforts, like you are running fitness shows, you are doing more than you know. Believe you me. That exercise alone.
Wow.
In fact, if everyone subscribed to a gym,
I'm humbled.
or do physical activity, I can tell you, there will be an effect.
Yes.
You might not see it now, but in the long run, it will be there.
Thank you.
So we want, let us appreciate the burden that is cancer. It is consuming us. It is leaving families poverty-stricken. They are using their every resource. It is time we wake up as a country and start emphasizing on this thing called cancer, not just in the month of November, October, breast, and no. Let us preach it every single month. Let people of goodwill decide to choose, let me deal with cancers of the blood and create awareness. Let me take these cancers of the bone and create awareness. And if we approach it like that, then we will be on top of things. Yes.
Mr. Robert?
I think I want to commend you, Philip, a lot for the show that you have been doing. Dr. Atandi has said that you have single-handedly been fighting this cancer on your own. But it is a fight that we want to join hands in, and we want to fight together, because losing 21,000 people every day is a huge loss on human resource. It's a huge loss in capital. A lot of breadwinners are going away.
True.
And families are spending a lot of money, in the tunes of millions, even billions per year, to try and just help their families, help the people who have cancer in their families. I mean, it's not the first time we've seen a pay bill number out in the public where people are trying to raise some funds to be able to tackle this. So I want to thank all the stakeholders, everyone who is trying to do something in terms of raising awareness. I want to encourage ladies. This is a month that has been specially crafted for them. Let them come to hospital, let them have pap smears done, let them have breast examinations done. Right now you find some places, like where I work, we are doing free clinical breast examinations, and we are teaching ladies how to do their own breast examination, so that they know when something abnormal develops, they know that something has started and I need to get checked. So it is a point, and it is very good that you've invited us for this show, because now we've been able to speak to more. We speak to them in our clinics, but now we have been able to get a bigger audience where they have been able to learn a few things. Of course, we would have loved to have more time.
Yeah, true.
But we want to thank you for just this short duration we've had, and we've been able to give the knowledge that we have. So we want to thank you, Philip, again, and let everyone now start. Every stakeholder in this medical field, in the health sector, including nutritionists, guys like you doing exercises, guys need to hold hands, need to work together to start up networks so that we can be able to slay this Goliath.
Kabisa.
Yes.
All right, you've heard of Ngae, in that linguistic, you've heard of Permisphere, you've heard of 21,000 people dying daily, and we have the opportunity where we can venture into this war and come out winners. Today I'm so humbled, because being told by the doctors themselves, I'm one person who is fighting it even without knowing it. Guys, it's a higher time. As I usually tell you, your health, our focus. And on NutriFit, doctors, I usually tell them, don't eat test, eat nutrients. And I feel blessed, because this is not a stage-managed kind of a show. This is a lifestyle show. This is whereby we will have you the next 5 years, the next 10 years, the next 20 years, taking you from one level to the other. From my side and Focus TV, we would want to do it much bigger and better. Just by you making sure you're following everything you're doing. We've been streaming live on Facebook, and you're going to get the content being there for you. Wherever you didn't capture the point, you can still revisit, view it on our channels on YouTube, Instagram, Facebook, Twitter, and also on my channel, that is MacLeod Philip. Continue coming in, and I'm just telling you right now, it is just the beginning. We don't need to wait for any help from abroad for us to do it. We got to push it by ourselves so that we can reach there. Thanks for watching. Till tomorrow, it is a goodbye. Lovely, lovely morning.